So it sounds like oxygen has made a pretty significant improvement in your quality of life. But we all know that not every therapy is perfect. So can you share with us some challenges that somebody new to oxygen should possibly expect as they get used to this therapy?
Yes, yes, it does take time to get used to it. I agree with that, Mike. There's a lot of challenges, but a lot of it depends on your physician, your respiratory therapist, your DME, your durable medical equipment provider. The challenges I had initially are that I don't weigh very much. I'm kind of short. A lot of the equipment back in the beginning, the portable oxygen concentrators, back in the beginning, they weren't really portable as far as I was concerned. They were bulky, they were heavy. So one of the challenges I had was in learning more about the equipment, learning what was right for me, what would work for me. What works for me, may work for you, it may not. And you've got to become involved. You have to start reading. You have to, join support groups where you can ask questions of other patients. They can't tell you what to do. That's impossible, but they can say, well, what I did that worked for me, so on and so forth. Check with your doctor, check with your respiratory therapist. Yeah, there were quite a few challenges at first, but over the years, oxygen therapy has gotten it's gotten easier. The units, the portable oxygen concentrators are much lighter weight. No, they're not continuous, most of them, but I'm able to get by with pulse. I can even sleep with pulse, which many patients can't, and that can become a problem. The challenge currently has been that because of the pandemic, there's just not been enough oxygen available. I'm fortunate. I do have a POC, portable oxygen concentrator. I do have a stationary concentrator. I do have some of the tall tanks to use for backup. But I have heard that it's difficult for patients to access oxygen at home, and many of them have been kept in the hospital on oxygen when they could have been sent home if there had been an availability.
Yeah, that is unfortunately something I have heard as well, and something that we in the oxygen community certainly would hope that we can figure out a way to resolve very soon. So
Yes.
hopefully, it sounds like you've had some very good resources along the way to help you get used to this therapy and help you overcome some of these challenges. And we certainly hope this video and the accompanying website can assist with that as well. You mentioned support groups and things like that. Have you found a robust community of people using oxygen so that it's as a good reminder that you're not alone in this?
Oh, absolutely, absolutely. The COPD Foundation is a wonderful resource. Then there are online support groups on Facebook. There are what do you call them? Listservs, such as Efforts, which is an email exchange. There's a COPD Navigator is on Facebook. There's just many, but you have to really take a lot of it with a grain of salt, because unfortunately, on Facebook, there are people who don't know as much as they think they do. and so the benefit is that there are many members who have a little more knowledge and who will chime in, and hopefully there's an administrator of these groups who will correct erroneous statements. But to me, it's very beneficial, and the COPD Foundation I find to be, and the American Lung Association, they both have good, solid information that's vetted and you can trust it.